New at 5, the CDC investigating 5 children's deaths that could be linked to a mysterious liver disease.
The number of suspected cases is growing at a rate that may alarm some parents. Take a look. The agency is now investigating 109 cases in 25 states and U.S. territories, including here in Georgia. 11 Alive's Liza Lucas is here with big takeaways from the CDC tonight.
The CDC releasing these numbers within the last 2 hours, and tonight the investigation, it continues into what is causing these mystery cases.
More numbers, more questions. Following the CDC's first national update this afternoon on severe hepatitis cases in kids.
Of course, it's scary when you hear about this, but I think the take-home message for right now is that these cases are still very rare.
While rare, it's now half of the country reporting the unusual cases of hepatitis or liver inflammation in kids, following the CDC's initial alert 2 weeks ago.
The main purpose of this alert is to find those cases. You know, as clinicians, sometimes we're isolated. And when we get these alerts, we become more aware of things we should pay more attention to and report back to the CDC.
In those reports, more than 90% of patients needed hospitalization. 14% needed liver transplants. The majority of the kids have recovered, but it's still not clear what's driving these cases in young children. The CDC says about half had had an adenovirus infection, but it emphasizes this is an evolving situation. The CDC also looking at possible environmental exposures, medications, and other infections that could play a role, including COVID-19 exposures and infections. In the meantime, doctors say parents should not panic, but be aware.
Be alert to symptoms that their children may have, such as jaundice, fatigue, nausea, vomiting, diarrhea. Those are all telltale signs of hepatitis, and the child should see a pediatrician right away.
I have been repeatedly checking in with the Georgia Department of Public Health for updates. Georgia, again, one of those states that is investigating suspected cases, but DPH so far, they've not been able to confirm to me how many cases we could be dealing with here in the state.